Good afternoon. This is Francisco Gutierrez, shooting a head-to-toe video with presentation for this video. I'm using my son. I have given full permission for this video as well as his mother. And Frankie, are you okay with me shooting this video? So we are okay with that. Trying to avoid any HIPAA violations. I won't give any other info on him. Upon entering the room, Frankie's gait was steady. It was good. He was able to answer questions appropriately. He's alert and oriented times 3. He knows where we're at, president, his full name, date of birth. And I assessed him right away for cleanliness, his grooming, seeing if he was wearing the accurate clothes for winter, since it is winter where we live at, or it is really cold out, so he was dressed appropriately. So those are quick glances that I look for. Frankie, I'm going to start right away with assessing your head, and during the head to toe video I will also be assessing his skin, turgor, temperature for any lesions, any skin abnormalities, and things like that. Alright, Frankie, I did provide privacy, and I did wash my hands before this head to toe assessment. I'm going to touch your scalp here, and I'm checking for any abnormalities, symmetry of his hair, and at the same time I also check to see for cleanliness and making sure they have no bugs, etc., or any other skin issues. So I'm not noticing any skin issues at this point. Does it hurt when I palpate your head like that, Frankie?
No.
No issues whatsoever. Okay, we will also touch his maxillary lobe, frontal lobes. Any discomfort?
No.
Okay. I will check his ears. Any tenderness there? No issues there? Okay. I also want to make sure I check his temporal artery and as well as his TMJ. Can you wiggle your jaw side to side, up and down? I don't feel any clicking or any grinding, any or abnormal sounds with palpation. I also want to check his preocular node, front of his ear, and posterior node and back of his ear. And at the same time, when I'm assessing Frankie, I am also checking cranial nerves. And the way I like to think of nerves, cranial nerves, is I smell with one nose, I see with 2 eyes, 3, and then you have a 5, 7, 8 for balance, and then your tongue is 9 and 10. The middle of your tongue for taste buds would be 7. The tip of your tongue, 12 for movement. We will begin with checking facial symmetry. Do you have any issues? Can you frown? Smile? Move your eyebrows up and down. Okay. I will be looking at his eyes. They're symmetrical, equal bilaterally. I will also be looking at his scala, his pupil, his iris, and his conjunctiva. His conjunctiva I will pull down on the eyelid. I will also pull up gently. And for better inspection, I could also use a Q-tip on top of the eyelid and flip it upside down. So I have no issues there. I will also check his vision, which is cranial nerve number 2. Can you please read the bottom numbers?
2, 3, 4, 5, 6, 7, 8, 9.
Okay, that is perfect. I will also check his ocular motion and 6 fields of gaze. Can you follow my finger? Perfect. And I'm going to check for accommodation. Just stare at my finger. Perfect. And those check cranial nerves 2, 4, and 6. No, excuse me, 3, 4, and 6. Vision is 2, and ocular motion is 3, 4, and 6. I will also check his pupil reaction to light. His dilation of his pupils is fast and brisk, which is what we want to see. And I will also check for your iris, your red light reflex. And basically I'm just going to look right at your eye. Perfect. Perfect. Okay, I'll change these out for my next inspection. Also, on the 6 fields of gaze, I want you to cover your left eye. I'll cover my right eye. Now I want you to tell me when you see my finger.
See it. See it. See it. See it. See it. See it.
Okay, perfect. Now we'll be checking his ears. Back to his ears. I was kind of jumping ahead of myself. So I'm going to check his ears again for any abnormalities. They're symmetrical. Any discomfort when I touch your ears?
No.
No discomfort. And I will check his preocular and postocular nodes as well. I checked his submandibular and superficial. Oh no, submental. Excuse me. Submental. Okay. We will be also looking in his ears at this point. I will take my otoscope and I will be pulling up on his ear. It's nice and pink with some earwax noted in the ear canal. The outer ear looks good as well. I will also look into this ear quickly. Pull up again. This ear, the tympanic membrane is clear, but it also is pearly white with a slight shiny fluid-filled tympanic membrane, and that is an expected find, as we did go yesterday to get a flu shot for him and general checkup, and he does have a right fluid. He has fluid in his tympanic membrane, and he has a sinus infection. So that is a find that I was expecting, and he is on Augmentin for that. Started yesterday for 10 days. Okay, now we will be looking, we will be moving down to his mouth, making sure it is symmetrical. Oh, let me catch myself. I'm getting ahead of myself. For his ear, I want you to tell me, we're going to do a whisper test. Tell me what you hear. We did the whisper test there, and he is able to hear that. Now I want you to tell me if you hear this. This is the Weber test.
Yeah.
Okay. Now we're going to do, I believe it's the rain test. Raining test. You hear it? Okay.
I hear it.
Tell me when it stops.
Stop.
Alright, do it one more time.
Stop.
Okay.
Stop.
Okay. And that is the final we're expecting. His hearing is he's able to detect it on instead of bone conduction. He can hear it twice as long when I do the ring test, which is an expected normal find. Now we will be moving to his mouth. His mouth is symmetrical. I'm sorry, I'm losing my place here. We will be doing his nose. We will check his nose for symmetry, make sure it is midline and there is no deviation. I will be looking for his nose mucosa as well as his turbinates inside his nose. Have you ever had any injuries to your nose or any nose surgery at all?
No.
Okay. Can you cover one nostril and breathe in? Now the other one? Can you tell me which one you can breathe better? That one? Okay. And I'm going to look into your nose quickly. Okay, the turbinates are nice and pink. No deviated septum noted. One more time. Nice and pink, no deviated septum noted. The turbinates are pink as well. I will set this here since I have no trash can. It is fine, and typically here I would wash my hands again and sanitize as well before I move on. His, like we said before, he has no deviated septum. His nose is symmetrical. We will test. Can you close your eyes and tell me what you smell?
Coffee.
Coffee. As I said before on the cranial nerves, that is cranial nerve number 1 for smell. Now I will check his mouth. It is symmetrical. His lips do tend to be a little dry, probably from licking his lips or being outside in the cold. I will have him open his mouth. I will check his teeth, his oral mucosa, as well as his uvula. Can you stick out your tongue? I'll press down. Actually, let me check his mouth. Tonsils are nice and pink. The pillars on both sides are nice and pink. No inflammation noted. His teeth appear to be nice and clean. No noticeable issues there. Gums look nice and pink. Can you say ah? That is cranial nerves 9 and 10. The movement of the uvula, as well in 2/3 of his tongue, does have cranial nerve number 7, which also affects taste buds. And then can you stick your tongue out, move it around, up and down, and that would be cranial nerve number 12, the tip of his tongue. Okay, so now we're going to check his neck. I'm going to check to make sure his trachea is midline. Do palpations beside it. Does this hurt? Any discomfort noted?
No.
Okay. I will also, while I'm here down in your neck, I will check your traps, trapezius muscle, your sternomastoid nodes. I want you to shrug your shoulders up against my hands. more. This is also checking cranial nerve number 11, and that is good. Back to his neck, I'm also looking for jugular distension. No jugular distension noted. I will also listen to his cardioid artery, which is what you would be palpating right before you do CPR on somebody. Make sure they have a pulse. Okay. Well, just breathe normal. And when I'm checking for your cardioid artery, I'm checking for any loud swooshing sounds, which would be a bruit, and we don't want that. So I didn't hear that, so it is fine. I'm also going to palpate the superficial clavicular node and his deep clavicular node, which is below the clavicle, and the superficial is above the clavicle. And I can't feel those, so it is fine. And I also check for his thyroid gland. No issues there. Okay, now we will move down to your neck a little further, and I want you to check your range of motion. Move it around. Any pain or discomfort while doing that?
No.
Okay. That's also with cranial nerve 11. His range of motion to his neck is good. I did not find any abnormalities in his neck. We will move to his arms. As I'm doing that, I'm also checking for skin. He does have a mole here on his right arm. So I would document that on my charting as well as part of his skin assessment. I will check his range of motion on his shoulders once again for trapezius muscles. Now your elbows, can you go back like this? Okay, your wrists, your fingers, touch them. Okay, perfect. I want to test your strength. Can you grab my hand, squeeze them? Okay, pull them towards you. Okay, now I'm gonna push your hands down, raise them up. Okay, now your hands down, push them down. Push my hands down. And equal range of motion, equal strength bilaterally on both arms. Also, I want to test the feeling of his hands. I want you to close your eyes and tell me what you feel in your hand. And it's called sturgill nosis. A penny?
Mm-hmm.
Okay.
Poke.
Poke.
Vibration.
Vibration. Okay. And before I forget, I also want to point out what cranial nerve number 5 on the face does. I want you to tell me what you feel.
Soft.
Soft? Okay, that is cranial nerve number 5. Okay, so your hands was good. I will also check your brachial pulse. Radial pulse. And of course, you always want to do this to both extremities. Okay, I want to check your reflex for your bicep. And we'll also check this radial. There you go. And we would do that to both hands. Due to time constraints, we will not do that at this point. Now I want to check your chest. Well, actually, I'm going to check his posterior chest first. I want you to lay on your stomach if you can. I'm going to raise your shirt, okay?
Okay.
At this point, I would assess his skin right away, first thing. I would also check his back for symmetry. Can you take some deep breaths? I'm checking for thoracic expansion. Okay, now I want you to say 99, and I'm checking for tactile fremitus.
99. 99. 99.
Okay, now I'm going to check for different sounds. I also want to check for CVA tenderness. Did that hurt when I did that at all?
No.
Any tenderness when I did that CVA check?
No.
No? Okay. I also want to listen to your lungs. Take a deep breath. Okay, that is perfect. And while you're on your stomach, I'm just going to check your strength on your legs. Can you lift up for me? And this will go on my lower extremity checks. Can you push your toes down? Up? Perfect. Equal strength bilaterally. We will check your anterior chest now. Your front of your chest if you sit up. I mean, lay on your back, correct? So I'm going to lift your shirt up again. And right away, my first assessment, I'm checking for symmetry. Skin, his abdomen, all at one time. There is no skin issues. It's symmetrical. So I want you to take some deep breaths, and I'm going to check for tactile fremitus. All right, deep breath. Perfect. I will also listen to your lungs. Take deep breath. Perfect. Any discomfort when I did that, Frankie?
No.
I also want to listen to your heart in five positions. So, aortic, pulmonic, Erb's point, tricuspid, and mitral. And then while I'm doing that, I would also do it with the bell after doing the diaphragm. And while I'm assessing the heart, I would also check the apical pulse for 30 seconds. And of course, if I wanted to wait the full minute, that would be good as well. Okay, no issues there. Now I'm also going to check for different sounds. Does that hurt at all? Any issues?
No.
I will also check the PMI, which is under the deep clavicular side, which is also aligned with the fifth intercostal space. Okay, that's good. And then while he's on his back, I will also assess his abdomen. First, I'm looking for any bulging as well on his back. I didn't see any bulging, any issues to address on his chest and abdomen. I don't see any bulging, any distension. I will also listen to your 4 quadrants. Okay, I could hear all 4 quadrants. No issues noted there. I will palpate now. We'll do this lightly and then we will do it. We'll get deeper. Any pain or discomfort?
No.
Okay, you can sit up now. Okay, so now we will be doing your lower extremities. I also wanted to check, actually I want to check your horizontal and vertical inguinal nodes. So about right here. The femoral artery. Perfect. And if you can lay on your back, I'm going to check your hips. Can you kind of lift your legs up? And now make an X. Okay. The other way. Up and down. Up and down like this. Here, let me see your legs. We'll do a little smoothly. Up, down, side, side. Any pain or discomfort? Anything up in your hips here?
No.
No? Okay. Now you can sit up. Okay. Of course, I would have in a hospital setting, I would have his the veteran or the patient in his skivvies, and I would assess the skin and make sure that is fine. When we did the chest exam, also you need to, around the same time of the month, do a breast exam, and that you could do, you lay on your side or do it in the shower, and what you can do is go up and down like in a vertical motion, like the lawnmower motion, or you can go around, and at the same time, in the shower, when your hands are nice and warm and your body's nice and warm, the hot shower makes the testicles drop. So you would grab your testicle one by one in your fingers and with the thumb on top, kind of work it around, and you are not to feel any pain or discomfort or any abnormal bumps additional to your testing. If you do, you contact your provider immediately. Okay, and do that so you don't forget. Do them at the same time each month, same day. So now we will check your popliteal pulse behind in the knee, the tibial pedal pulse, and the pedal pulse. Okay, I also want to check your knee, your patellar reflex. Okay, we'll do dorsal. Perfect. Transfer fall enough. I would also check your feet for sensation. Can you close your eyes? Tell me what you feel.
Vibration. Oh. Oh.
Okay. Now, would you stand up for me? And would you walk on the tips of your toes? Okay. Your heels. Can you bend over and touch your toes? At this point, I also want to check the spinous process, as I should have done with when I checked his back. Spinous process is good. Now you can stand up and sit back down. At this time, there is no issues noted. I'm trying to make sure I covered the complete head of toe accurately. Oh, I did forget to assess your chest for aortic bruit. Can you lay back for me? No issues noted. That concludes our head to toe assessment.